Do supplement expiration dates really even matter? Which is a funny question to ask somebody who almost exclusively uses supplements that are beyond expiration date. It's a half serious thing that I'm saying. I always joke that it's the shoemaker's kids in my house. We use whatever's there instead of the best, like the freshest stuff off the boat. I normally let everybody have first dibs, and then I take whatever's left. I'm not afraid, though, to use these things, and that's normally for good reason. There's a specific set of parameters that gives me confidence in what I'm doing. And hopefully, I guess, once you understand the things that I think about, you can have some confidence, too, and at least make a better decisions about, supplements and expiration dates and all of that other stuff. So you should know that generally I'm not in the camp that you should use supplements after expiration date, because you're probably not going to get the same set of parameters that I have. They're not going to get aligned for you as well as they will for me. You won't be as certain as I am. So in that situation, because you don't have the training and expertise, it might be best to just be like, I'm going to pitch these. But we'll talk a little bit here, and hopefully you can make better decisions by the end of it. So what is an expiration date? Are expiration dates even real, or is it just like the tooth fairy and we need to question reality? Well, an expiration date is not even legally required to be on a supplement bottle or even determined by a supplement manufacturer. All they need to do is put on the manufacture date, the date that the product was actually made. The expiration date is an optional thing. And if they want to put the expiration date on there, they need the studies to prove the expiration date is that date. But those studies come at a cost. And that cost, in my opinion, is, of course, worth it. Let's just put a scenario out there. Today, it's 2023 when we're making this podcast here. What would you rather buy in 2023? A supplement with a manufacture date of 2020 or a supplement with an expiration date of 2024? And it's a trick question because it's the same supplement, right? It's the same exact thing. Made in 2020 with an expiration date of 2024, but there's a consumer psychology to expiration dates. It's this magical thing, that creates, this sense of confidence in a product, and it can really influence a purchase and how you can make that purchase a small purchase or a big purchase or no purchase at all, right? If I have a long expiration date, I'm going to be more likely to say, I'm going to stock up. I'm going to order 3 or 4 of these at a time. If it's a short expiration date, I might skip it entirely, right? Was that thing manufactured 2 years ago? No way. I wouldn't put that in my body. Meanwhile, the other stuff is manufactured in 2 years too. This added cost of doing these expiration dates has to get measured against some sort of a benefit. So does it make sense for us as a supplement company financially to have data for expiration dates that go beyond 2 years? And most companies will say probably not. The assumption for many common supplement ingredients is that the actual expiration date is longer than any of the expiration dates that are printed on the bottle. And that's something important to understand. Those expiration dates are just kind of there, and it's a cost-benefit analysis, and it's probably fine for well beyond that. But it's not always fine, but it's probably fine. We joke in the store, calcium is a rock. It's not going anywhere. It's going to outlive us all. And, yet we have a 1-year expiration date on calcium. At the end of the day, expiration date is a measure of potency. And supplement expires legally when it no longer contains exactly 100% of the labeled claim. So if I say I have 10 milligrams of, let's say, melatonin, because I'm going to use that example a little bit here, I need to have 10 milligrams right through the expiration date. And that 100% requirement is actually really strict because in pharma and even compounding pharmacy, like we talked about last week when we were talking about Ozempic, they've got some variance. With compounding, we can set a beyond use date, not an expiration date, but a beyond use date that has 90 to 110% of the labeled claim throughout the life of the product. So lots of variance there, right? So there's 2 things to consider here. In order to always make sure that you do have 100%, that very strict number, companies will put in more than what's actually on the bottle. You need to have at least 100%. You can have more. So the example again, melatonin degrades really quickly. So most of the melatonin that you buy, if it's quality stuff, will have probably 15% more melatonin in the bottle. Kind of throws off your numbers, right? If I'm taking 10 milligrams, well, actually taking 11. And as we said in the sleep podcast, melatonin isn't even dosed at 1 milligram in most countries. And so therefore, your rounding error in the product that you're taking is equivalent to what other countries are even using for that supplement. Very important to kind of put it all together, huh? The second thing to think about is that your product technically expires if you have 99% potency. Technically, I'm just kind of like throwing out random stuff here, nothing like specific. But, if the expiration date is guaranteeing 100%, technically at 99%, it's expired. But does that make the product bad? If it's 99% potent, I would take a 99. I would take it. I took many tests and I've gotten 70s and we're happy with it, right? If we said before that expiration date endpoints are oftentimes arbitrarily set, will we actually even be losing potency? And that's something that I always like to kick around in your head, right? If technically the 2-year number is just a stop point because they don't want to spend any more money on the test, and the product can actually expire 3 to 5 years out, at 2 years, are you really going to be losing anything, especially if they're putting more than 100% in the bottle? And this is where people start to go crazy. Why bother? Why would I even care about a supplement's expiration date if all these variables are true? It's because the concern that we have about expiration date is, will this product hurt me if I take it after expiration? And the answer to that question is simple, right? The answer is no. Expired products don't morph into something harmful. There was some concerns about a tetracycline-based compound that caused kidney damage in someone that was taken after expiration. But there's like the one case study and that's it. And most people were like, there's probably something else going on, right? When a supplement product in particular decays, it just becomes less effective, and that's over time, slowly. So technically, an expired drug can hurt you though, right? Because if it's important and you're not getting enough of it, that's going to hurt, right? So if we're talking about medicines, just in this example, blood pressure medicines, mood stabilizers, diabetes medicines, insulin, EpiPens, right? All things we don't want to mess around with when we're talking about potency. We don't want to have any variance from that 100% potency. We want to know exactly what we're getting. Supplements for, allergies, that's kind of important, but, taking a fish oil pill, is it a big deal if it's a little bit less than 100% potent? Probably not. So listening to the points that I'm presenting here can easily bring you to a simple conclusion, a place that a lot of my customers and patients come to. Expiration dates for supplements really don't matter. I'm just going to keep taking these supplements beyond expiration. But there are still other factors to consider. But overall, again, I agree with you. I do it. I think that if you're looking just from an expiration date standpoint, you're right. It's probably an arbitrary number, and you're probably not. You're definitely not going to get hurt from it. So why not, right? But so let's consider these other variables before we make our decision. So expiration date is a measure of mostly potency over time, right? But that measure is under very specific conditions. So here's the one thing that you're not considering when you're talking about the expired products that are in your medicine cabinet, the storage conditions, right? Can you guarantee me that your medicine cabinet is controlled room temperature and not having a humidity exceeding 40%? I don't think you can, right? And in fact, like your temperatures are all over the place in your house, and it's probably very humid wherever your stuff is. Temperature and humidity are the two main things that break down pharmacologically active compounds like drugs and supplements. And that's why we tell folks no more bathroom when it comes to the storage of your medicines. Lots of water, really high temperature. And so there's a real possibility that the products that are stored in your house are degrading at a rate quicker than those in those expiration date tests. Within reason, of course, right? So theoretically, the expiration date is set based on good storage. And if you're kind of doing willy-nilly or not even considering those variables and say putting it in your bathroom and not using the vent and closing the door and it's really high moisture and really high temperature, we can't say that that expiration date is still true for that product. I store my products in a specific place, and I actually track humidity and temperature in my house, especially in the areas that We store medicine because I'm a nerd and I know this stuff. So if you're going to do that, then I'm all for it. But we have to consider that the expiration date may be not even relevant to you because of how you've stored the product. The idea that the product is also stored in its original container is something that's missing from a lot of people. People will take their supplements and put them into the weekly pill things, which is fine. I recommend it for some people. Try to have people not go more than a week or two because you're removing them from the containers where they've been tested for potency, and then you're putting them in containers that haven't had that same testing done. And so theoretically, if they sat there for a long period of time, they could be exposed to all of the elements and then degrade faster. And we don't want that. So you certainly wouldn't want these things in packages that, these containers that are, 4 months packed out at a time. Or we've had patients come in and they've had like little glass ampules and they thought they were doing better by putting it into these transparent glass ampules instead of the light and temperature and humidity controlled bottles that they come in. So we've been focused on potency here. Will this thing hurt me and will it even work around expiration dates? But here's something that you might not have considered when we're weighing all of this stuff, the gross factor. Do you want to ingest something that's been sitting around for a few years, especially if it's food-based? What if it's fish oil, man? That is nasty, yo. It's been stored under fluctuating temperature and humidity. Imagine just like fish on the counter just for a while. And you're like, I'm going to goggle that up. It's good. The expiration date's arbitrary, right? And so we have to think about all of this stuff, the bugs, the molds, the yeasts, and the general grossness of all of this needs to be considered when you're making a decision on whether or not to use that supplement past expiration date. And again, this is a podcast. This isn't meant to be so freaking heavy and nerdy. We've had a thorough enough conversation, I believe, here. I will direct you to drnealsmoller.com, drnealsmoller.com. I have a blog and I have a great article, very in-depth dive around expiration dates. There's something that I didn't include here, the tricks that supplement companies do to fool you with expiration dates. And that's a good teaser because it's really good information. Just how they label the product and what they say is expiring and what isn't expiring is a trick. There's even some tricks with probiotics that supplement companies do pretty blatantly, but that you wouldn't even know. So check that out. And there's also some other factors to consider around packaging and how the thing is stored and presented in the store that you need to think about before you make your final decision on whether or not you're going to use the expired products. So in summary, do expiration dates even really matter? And I'll say that an expired product won't hurt you. And an expiration date is technically arbitrarily assigned as a cost-benefit analysis done by a manufacturer, right? We're going to set it up as something that's just like, this is what we'll pay for, right? So what you should be concerned with as a consumer is more like an overall freshness, we'll say, right? So how was my product stored? Was it stable temperatures and stable humidity? Was the container the original container? Was it sealed? Or did you put it in a plastic bag and then throw it in your bathtub, right? That's going to be not so great. And then what's the relative importance for this thing that we're talking about? Are we injecting this into Uma Thurman's chest during that one scene in Pulp Fiction? And if we are, probably we want some fresh stuff and a really long, clean needle, much cleaner than what they used. So you can do this calculation yourself, certainly. But here's the thing that I want you to noodle on. And the point of the next part of the podcast is, why do I even have an expired supplement to begin with, right? Chances are it's because we haven't implemented a supplement strategy to evaluate if that supplement should even be hanging around our medicine cabinet to this day.